Welcome to Deuk Spine Institute. You're watching live spine surgery broadcasted over multiple platforms on April 8, 2025. I'm Dr. Deuk Majan, CEO and founder. We've been broadcasting live spine surgeries for 10 years now from Deuk Spine and Surgery Center of Vieira. Our patients come from all over the world, and this patient has severe arthritis in his lower back in the facet, F-A-C-E-T joints and discs, but his pain is primarily coming from the facet joints. The facet joints are the second most common cause of back pain, and they cause back pain in millions of people with back pain all around the world. And Henry is going to show you a video that explains how these joints cause back pain, these facet joints, okay? Meanwhile, I'm going to get started on treating his facets.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Great, thanks Henry. You just shared with us our video on how we eliminate facet joint pain. Oh, why not? This is the bottom nerve right here I'm at, so why not? We'll fix this one while we're here. Shot? I was going to go to the one above it, but let's do this one. Shot? Uh-huh. All right, very good. And one more to go. My target, Jordan will show you, is the pain nerve at the back of this disc. Sorry, the pain nerve at the back of the facet, and that is at the back of the disc. Perfect. Right there. That is the perfect spot. Well, let's hope this works for him. This is the right side. I'm going to move on to the left. Before I do, I want to show you, I'll go ahead and pull out. We're going to show you his incision, which is tiny. Okay, he has a tiny incision. Putting a little medicine in because the procedure actually does some burning deep inside, which may be uncomfortable for him. You guys see this incision here?
Yes, we do.
It's quite literally 4 millimeters long. Just like the video. And then of course the Deuk laser disc repair is 7 millimeters. We did that earlier. We're now going to go to the left side and fix the left side facets. When we're done with the facet joint treatment for his facet pain, we're going to do his piriformis. Now I want you to know that, come on in Jordan. I want you to know that this Deuk plasma rhizotomy, it's patented, it's all FDA approved. It's only available at Deuk Spine. So if you want to get rid of facet pain permanently, you got to come to Deuk Spine Institute. Other doctors are doing just temporary treatments. But let's be honest, who wants a temporary fix? Nobody. Everybody wants a permanent fix where we get rid of the pain permanently. Sean? All right, so let's see here. We've got that there. We've got 5, 4, 3, 2. I think right there is a perfect spot to enter. Go ahead. So basically we're going on the left side of where we did the right side. I think is that your head moving or his?
Yeah, I'm moving.
Okay, good. Any questions? Yeah, he's snoozing.
Yes, we have a question coming from Henmeister on YouTube.
All right, Henmeister, bring it on.
Asking, how would you eliminate pain without spinal fusion surgery? What type of procedure would that be? Also, thank you for your amazing answers.
Oh, you're welcome. So, my friend, I'm not saying this negatively by any means, so please don't take it the wrong way. But we have been curing back pain without fusion now for 20 years at Deuk Spine, and that's why we do our live streams. Because people think that, number one, back pain is not curable, but number two, if it is going to be fixed, the doctors are recommending fusion. And yes, fusion can eliminate back pain from the disc and the facet. And by the way, if you watch the beginning of the surgery, we show you in a video where pain comes from. It actually comes from the disc and the facet. Those are the two most common causes of back pain, disc and facet, okay? But there are two other causes, the SI joint and the piriformis muscle. And we have treatments that literally cure pain from all 4 places. If you took all 4 places, disc, facet, SI, and piriformis, that encompasses 99.5% of all back pain. All back pain, okay? So we have a cure for 99.5% of all back pain, and it does not involve fusion. We are not fusing. You don't need to fuse. I used to do fusions all the time. I did fusions because, well, that was the only way I knew how to cure back pain. I was doing fusions back in 2000. All right? Because back then I didn't have this laser procedure and I didn't have the plasma procedure. I only had fusion. And fusion works if you do it right. But with fusion, you got to do it not just technically right, but you have to do it at the right levels. So you can't just do one disc at a time, otherwise the patient will still have pain. You've got to treat all the painful discs and all the painful facets at the same time. All right, we've done 2 now. What we're destroying is the medial branch of the dorsal ramus. Henry, have you shown the audience what we're doing here
Yes,
with our video?
correct.
Right. So if you guys go back and watch the video earlier, it shows you that basically we're curing the pain coming from his facet joints, and the pain to the facet joints travels along a small nerve called the medial branch of the dorsal ramus. Can you see the tip of that probe right there? Jordan, let's show them some anatomy. So show them the pedicle. You guys see this round structure? It looks almost oval, not round, but oval.
Yes,
a
we
little
do.
little bit more to the left too. Yeah, somewhere in there. That's the pedicle, and the transverse process is a bone, and Jordan's showing you. It's like sticks out to the side. And you see where the tip of my probe is? Like literally right there, there's a nerve. That's the pain nerve to the facet joint. So if you use the X-ray machine, you can find the exact spot where the nerve should be, and then you burn a little bit to the lateral, a little medial, a little superior, a little inferior in this area like a patch. And if you do that by wanding, which is my technique, it's the Deuk plasma rhizotomy, it's patented. Nobody else can really do it and promote it. If you do that, you'll destroy the pain nerve, and then the patient will have no pain. Now, these facets have 2 pain nerves each, one coming from the top, one coming from the bottom, so you have to get both pain nerves to that facet joint, the upper and the lower. All right, now because of all the arthritis, I'm having a little trouble seeing this next area. There's bone spurs here. So I just have to be super careful. Shot. You can see the pedicle. Show us the pedicle. You can barely make it out. Yeah, right there. And then the transverse process coming off right there. That's where, exactly where Jordan. Now you want to go to the top of the transverse process, which is exactly where my probe is. So I'm in the perfect place, and I know that because I can feel it, by the way, folks. I can literally feel it. Surgeons use their surgical tools as an extension of their fingers, okay? We literally can feel with the tip of our tool to know where we are and what we're up against. And I can actually feel the pain nerve getting cut there, like by the probe, by the tip of my probe, which uses radio frequency energy. All right, almost done. Shot. I need to go a little bit lower, and we'll be done. And then we're going to bring you back for one final thing, which is and that's the perfect spot for the next nerve. You guys see that?
Yes, we do.
And that's it. We're done. We're going to bring you back for the piriformis treatment in a moment. All right?
Yes, we have a question coming from Lanu on YouTube.
Hi, Lana.
Saying, about fusion, is there a certain situation where fusion is effective?
Yes, fusion can be very effective. So the thing to understand about the lower back, if you're paying attention to all my teachings, which I hope you are, there are two things that cause 95% of all back pain: the disc, the facet. Disc, facet, disc, facet. Fusion treats both the disc pain and the facet pain. So a properly performed spinal fusion will cure the disc pain where it's fused and the facet pain. What I do different is, instead of fusing and opening you up, I come in with a little incision. I go fix the disc pain with the laser, and I fix the facet pain with the plasma. So I fix both types of pain, but I don't do it with fusion anymore. You don't need it. Fusion is overkill. Fusion is like dropping a nuclear bomb on a Japanese city to stop a war, rather than using, I don't know, a strike force to go and kill the guy in charge of the war, the one who's creating all the problems. Or diplomacy. I'm using diplomacy. I'm helping your body heal itself. And fusion is like a nuclear bomb being dropped on Nagasaki or Hiroshima. It's horrible. There's massive collateral damage. Innocent people are dying. Women, children, people who don't fight in a war. People have nothing to do with the war. They're all innocent bystanders being annihilated. The city is radioactive for the next 100 years. And the water's polluted. The land's polluted. I mean, it's just a horrible thing to do. Fusion is a horrible, horrible surgery that should not be done. Can it be effective? Absolutely. Can a nuclear bomb be effective? You bet. Should it be used? Absolutely not. No, hold on. All right, we're going to be back shortly.